the maternal mortality and the infant mortality. So these are the various challenges which is common in India also. So if you compare rural India with urban India, so there was a 1 million death study that was done way long back, I think in the year 2013 and 14, and in which various causes of deaths were also elaborated. Although because in India we lack the exact causes of death, but that study mentioned that in the poorer country, or you can say in the rural area, so the maternal mortality burden was much higher as compared to the urban. So even if you compare in the richer part also, place of residence, so there also, so the rural maternal burden was higher as compared to the urban burden. So there is a lot of difference when you compare rural India as well as the urban India. So we'll see why that difference comes out. The next slide, please. So, so Dr. Raj has already mentioned the various causes of maternal health or maternal death, which was there in if you see the global challenge. So I will just depict some of the, you can say, figures or the data, the things which ma'am has already mentioned, like what is the status if you compare in the rural as well as in urban area. So like all of us know that during antenatal time, so there are 3 or 4 visits required so that we have the favorable outcome, that is the normal birth at the time of delivery. So if you see the antenatal checkup during the first 3 months of the pregnancy, so over and all, if you see, it is much higher in, you can say, in urban India as compared to the rural India. So rural India, because of, you can say, lack of infrastructure or the lack of availability of doctor or the staff, so this antenatal checkup during the first trimester, that is little lesser as compared to the urban area. So like I was telling you that under Indian public health standards, that is quality health standard laid down by Health Ministry of India, so there are at least 4 antenatal care visits which will be required so that no maternal death takes place, so that we should not lose any pregnant female, because it is a physiological phenomenon. Okay, so you can see here, if you compare this 4 antenatal care visits, so it comes down from 67.9 to 54. So only half of the rural females, they are availing the 4 antenatal care visits which are required, which ma'am has already elaborated, in which we have to have hemoglobin estimation, we have to have blood pressure estimation, we need to have weight examination, we need to give pregnant female the tetanus immunization, and we'll see here the how many pregnant females are protected against the neonatal tetanus. So this we are like having almost equal between urban and rural, because the tetanus awareness is there definitely, and we are giving this tetanus immunization. Again, it is not 100%. It should be 100% in our country, so that every female is protected against neonatal tetanus. And then, of course, ma'am also told anemia is one of the major cause of maternal death. Similarly, in India also, anemia. We see, you can say, severely anemic pregnant female coming in the rural area. So that is less than 7 gram %. About 10 to 13% of our pregnant female in India, especially rural India, they are severely anemic. So, and if you consider it as less than 11 gram % as per the reproductive and child health program, which is there in India, so again, it is 50% of the pregnant females are anemic in our country. So if you take it as 11 gram, and if it is, you take it as, you can say 10 gram, so it comes out to be higher. And also the iron and folic acid tablets, which we are giving to a pregnant female for 100 days. And also now there is a little change in the guidelines. We have to give it for the 180 days. So again, that prevalence is very, very low. So I think now we can correlate that because of this anemia is there, and that anemia is causing the high proportion of maternal deaths in India, and it is very higher in rural India as compared to the. So what we can do under maternal health? So we have to reach every mother. So email, so to provide them the services which are available at free of cost, so that they have the accessibility to these type of services. And continuum of care, ma'am has beautifully mentioned already that then of course antenatal care. So antenatal care, that is what I think which we need to focus on, and for that various schemes have been initiated by government of India, in which we have to to provide these pregnant female at least these 3 to 4 antenatal care visits, and then the adequate educating them on adequate nutrition, and the plan has to be made here. That is the delivery plan, where the delivery will be taking place. So like in India, if you say, if I will tell you the Punjab region which is there, so maternal mortality, you can compare with the national average also. So few years back, so half of the deliveries were at home only. So now with the introduction mentioned on the 3 delays, or like possible areas on which we can work upon, and we which government of India, or which even the sustainable development goals which have fixed for India, like 70 per lakh live births. So still it is beyond reachable. Next slide, please. Yeah, these programs what I was talking about, that is initiated by government of India. So that is Janani Suraksha Yojana. Now we have talked about maternal health issues in rural India and urban India. Similarly, we are also facing challenges about the infant health here, and infant mortality is very higher as in rural India as compared to urban area. Although things are improving, but still, and like ma'am has also mentioned that if if you see that 1 year of life birth of you can say the infant, so that first month is very crucial, the neonatal mortality which we call, and out of these 30 days of life or 28 days of life, first 7 days is very crucial, in which we call early neonatal period. So that these programs have been initiated to reduce that burden, that neonatal deaths or early neonatal first 7 days of life, in which we are losing many infants in our country, and especially in rural area, where essential newborn care, when the child is born, that is not available. And it has been seen that around 45 to 46% of these deaths happen during the first hour of delivery or the live birth. Okay, so Janani Suraksha Yojana, which is very successful, in which the beneficiaries are given some incentives, and we have appointed Asha worker here, which is from the community, and so that to overcome any social or cultural barriers. So with the help of these incentives which are provided to the Asha worker also, and also to the pregnant female. So the Asha worker is being given performance-based incentives. She will prepare the birth action plan, and then she will take the pregnant female to the institution for delivery, so that we can prevent all these maternal deaths in rural area as well as in a urban area. So and also the infant. So essential newborn care is being provided where the Asha worker will take the pregnant female for the delivery. So that early neonatal deaths will be avoided during that time. So Janani Shishu Suraksha Karyakram is again another milestone in which the first 30 days of life of mother as well as child is taken care of by government of India. So it is provided free of cost, the treatment as well as the drugs and the transport. Similarly, the Pradhan Mantri Surakshit Matritva Abhiyan that was initiated by our Prime Minister. So in which again it is the focus is on maternal and child health. And there was one quality you can say improvement initiative in which labor rooms are being initiated, and quality maternal care they are going to give, and of course slowly they are developing it, but definitely it's again good concept whenever we talk about the maternal and child health. Now these village health and nutrition days are very important. So every month in the village the health and nutrition day is celebrated, in which our workers they come at one place, and then Asha worker and Anganwadi workers are there. They are from the same community of that village only. So they will bring these mothers as well as the children to that particular place, in which all these antenatal care and the immunization and everything will be provided, and the nutrition education will also be provided to them. So next slide, please. Yeah, this I was talking about Janani Suraksha Yojana, and you can see here we have low performing state and high performing state. Let me tell you about some low performing state in which the indicators are very bad, where the maternal deaths are more in number, infant deaths are more in number, and high performing states like we have southern states, we have Maharashtra, we have Punjab. So and these are high performing states, and the states like Bihar, Rajasthan, Uttar Pradesh, Chhattisgarh. So these are low performing states where the lot of maternal deaths or infant deaths happen. So government of India, they give in rural area 1400 rupees for that purpose. So some incentive, and then in urban area it is 1000 rupees. So and similarly in high performing state it is 700 and 600. So this, and of course you cannot tell each and every person or any pregnant female to go to institution. There will be some barriers also. So even if she is being delivered at home, so by healthcare worker, so there also we will be providing them with 500 rupees to each and every one. So this is something, this program, because of this Janani Suraksha Yojana, we government of India have achieved some improvement in maternal and infant health, and we are able to reduce maternal mortality in India as well as the newborn deaths. And Asha worker is major component, and which ma'am also talked, and that we can involve these persons at ground level, our A&M healthcare workers, Asha workers, and maybe the technology part ma'am has told that we can introduce that technology part, and everybody is having nowadays using mobiles and everything, and we can use that technology in reaching out to the population. So they are being given around 600 rupees for ANC के लिए जो है for antenatal it's 300 rupees, and 300 rupees for taking pregnant female to the institution. So this is like Janani Suraksha Yojana, where it is working in India at the rural level. Next slide, please. These are the thrust areas under our child health program. If we discuss something about that, we should focus on neonatal and child health. So after the delivery, and like I told you, first 28 days are very crucial, and out of that, first 7 days are very crucial. So of course, we should focus here on some breastfeeding component, and for 6 months only and only mother's feed is beneficial for the child. So like that, this education has to be given to the pregnant female, like after delivery, the mother's feed is very important. So, and then of course nutrition, we have our Anganwadi workers at rural and urban level, so which are functioning and which are giving supplementation, nutrition supplementation. diet is being given at these centers, and also the nutrition education and management of common childhood illnesses. Ma'am has mentioned that the causes of infant mortality. So it's almost similar in India also. So prematurity, like if the child is born before the actual time of the delivery, or and then of course the other common cause of death is common infection, in which the child is suffering from any diarrheal diseases or acute respiratory infections or pneumonia. So like that. So we have to manage these at the grassroots level. So we are providing with our workers with some of the medicines, and the OPDs is also being run there. Immunization, and I think immunization is where we are progressing, but maybe we are still away from reaching 100% immunization coverage, at least for our first year, or you can say children which are infants. Okay. So that during 1 year of age, so lot of vaccines has to be given, starting from BCG against tuberculosis, and then we have polio vaccine. Although we have eradicated polio from India, but still because it's there in our neighboring country, so we need to focus on these polio vaccines also. Measles vaccine is something another which we have to focus, because it will prevent again these common childhood illnesses which I have mentioned here. So immunization, I think again here some technology can help us reaching to the other people which have been lacking, and maybe some alerts from the app that can also help us in this immunization, this one having successful immunization for under 1 year children. Next slide, please. Yeah. So like I told you, so we have the way forward here. Ma'am has also mentioned that we have almost now control or almost reduced the maternal and child health burden, and we are reaching to our goals, like nearer to goals which are there, but still we have to focus, or we have to find out some other ways to reach the missing link there, and where we have not been able to reach. So I think information system for maternal and child health can help us in reaching that like way forward where we have not reached. Or for example, tracking of pregnant women and children, the mother tracking program, MCTS, which that is known as in India. So which I think government of India has already started it, but I'm not sure how much successful it is going on, but we have to focus on it. And there is, I think there are many apps also working, like we have ANM online, our auxiliary nurse midwife online, and also some Kilkari app in which some 72 messages are being delivered to the pregnant female on pregnancy issues. So some of the examples are there, but I think we need more of such technology or the information system to reduce the burden of maternal and child health in India. So that's from my side. Thank you.